Morning, guys. This is Ken. I don't know what time you're watching this. This is Ken, Coach Ken, your wellness preacher. And this morning we're talking about men's health. A little dark in here. I apologize for that. But hey, thank y'all so much that were on our live earlier tonight, or today, whatever time it is you're turning in. We're going to be looking at insulin resistance as it relates to men and particularly men's health. Lindsay Venn is on here. I don't want to waste any more time. This is great information. Stick around. You're going to learn a lot. If you know somebody, share this with them. If you know a man in your life dealing with issues regarding men's health, that they're concerned about testosterone, any of this, this is perfect to share with them. Make sure that you pass this on, folks. We're going to jump right in. Let Lindsay get started. We don't want to waste any of your time, any of her time. This is huge. All right, here we go. Jumping right into
the root cause of so many problems in general health and chronic disease. And we're going to focus a little bit more today on what happens to men and where insulin can be the culprit. So Trent had mentioned erectile dysfunction for sure. That is a men's health concern, definitely. But some other things when I think of men's health are these things listed here. Things like your testosterone levels. How's your prostate? Where is your weight being carried and do you have too much of it? How's your energy and your stamina, general health, heart health? Do you have insulin resistance or type 2 diabetes? All of these things play a very important role, especially as men age, in how they do long term. And so I do point out there are a lot of factors to play when it comes to this. I like to focus on the ones that we have the control over. So things like diet, for example, our career, our lifestyle, our family support, where we live, those things we might have a little control of. Things like genetics, maybe not so much. But we're going to focus today particularly on diet and the Feel Great system and how we can improve overall men's general health as well as those factors that I listed. So, but to begin, Trent touched on it a little bit, but what is insulin resistance? I think it's really important to understand how this works. So insulin is a hormone or a peptide that the body produces in response to being fed. Every time we eat something, we're going to have a raise in insulin. And insulin's number one job is to dictate where that energy goes. The energy that we put in our mouth, where is it going to go in the long run? So this is a cell. Every cell in the body requires insulin in order to get glucose into the cell. And I'm going to use glucose and energy interchangeably because they're the same thing. Glucose is the primary fuel source for our cells. So energy is a term that I like to use. So when we eat something, we secrete insulin. Insulin from our pancreas enters into the bloodstream, and then it will go launch or put itself into this receptor site. And when it does that, that receptor site triggers this opening of this door. I'm going to use simple terms here. This opening of this door to allow glucose to get into the cell. Remember, this is the gas. This is the fuel that the cell needs. In someone with insulin resistance, this receptor site's broken. We actually don't have the benefit of insulin inserting itself into that receptor site because this doorway is blocked. It's not open and glucose cannot get in. And what happens here now is we don't have any energy in our cell. And our cell, just like our car, won't run if it doesn't have any fuel. I oftentimes will liken this to a lock and a key. If you want to think about your insulin receptor site as a lock on a door and this glucose transport mechanism as the actual door, if the lock is broken, the door cannot be opened. And insulin resistance is a broken lock. You can have as many keys out there as you can imagine. If the lock itself is broken, the keys won't work. And we'll keep making more and more and more keys until we find one that works. And that is what insulin resistance is. Lots and lots of insulin, but yet no fuel, no energy into our cells. And therefore the cells can't function properly. Another way to look at this is with this slide where we have somebody who's got normal insulin metabolism. They've got normal levels of glucose. They have this key over here that's going to fit directly into this lock perfectly. And we're going to have adequate fuel for the cell to function properly. In someone with insulin resistance, we have a couple of things that happen. We get high blood sugar levels, oftentimes result, but it happens. This key doesn't fit into this lock.
This is really important, and those of y'all that are coming in, so think about it this way. So this is what she's talking about. Every one of our cells, all right, has an insulin receptor. Here's the key right here, all right? It's picking up the glucose, all right? Every cell's got that, and that receptor is going to receive this. It unlocks that cell. When we are insulin resistant, it's full and it doesn't go in. I'm going to let Lindsay keep going, but I just want to kind of give that explanation real quick, maybe because sometimes that visual really helps. All right.
Because again, the lock is broken and now we have deficient fuel inside of our cell, so it cannot function properly. Why is this a problem? Well, when we look into men's health, there's a lot of factors that play a role. I love this slide because it really shows that this is a cyclic problem. One thing can lead to another, but yet the same thing can lead back to the other. The primary example here is low testosterone can create insulin resistance, or like they say here, metabolic syndrome, type 2 diabetes. But also in reverse, type 2 diabetes, insulin resistance can lead to low testosterone. Obesity also plays a role in this, as we know, because obesity is a byproduct of insulin resistance. So what happens is we get this cascading event of inflammation that leads to things like heart disease. We also get this erectile dysfunction that Trent had mentioned, and it becomes this vicious cycle of, how do I fix this? Where do I break this chain? Where do I break the cycle so that I can have normal testosterone function, normal masculine function, normal heart, your lower risk of cardiovascular disease and lower inflammation. And this is where we really kind of play our or place our main intervention is on, let's get rid of this metabolic syndrome in order to help. I wanted to cite just a couple of studies just to show that the research is out there. Ben, like Trent mentioned, I work with Ben Bickman very closely. Lots of studies that show that men with obesity, metabolic syndrome, type 2 diabetes have low testosterone, and men with low testosterone have metabolic syndrome and type 2 diabetes. They both lead to each other, which is a problem. They also show in different studies that if you can find a way to lose the weight, which is also helping to improve insulin resistance and maintain that weight loss, that testosterone levels will improve and they will remain and have a sustained increase in those levels by improving those things. And then last, I always like to point this out because this is independent of age. Sadly, we are seeing it. I see 20 and 30-year-old men all the time now who have low testosterone because they have insulin resistance. And so this doesn't just happen as we age, it can happen at any spectrum of the age span. And so we want to make sure that we're dealing with the insulin resistance, which is the primary factor we have control over. So a couple other things I wanted to touch on, because like women, we care about things like breast cancer, men care about things like prostate cancer. But there is a difference between what we call BPH, which is benign prostatic hypertrophy or enlarged prostate, and cancer, and where insulin plays a role. For those of you who don't know, prostate is only found in men. It's located directly below the bladder, and it does tend to increase with age and or insulin resistance. This study, and I love to point out this number, look at the increased prevalence of prostate cancer in people with insulin resistance. If you have insulin resistance, you have a 250% increased risk of developing prostate cancer. So what do? Again, we want to tackle the root cause. Let's get the insulin resistance under control. For those of you who don't know Ben Bickman, this is his book called Why We Get Sick. I highly, highly recommend it. He cites in there multiple different resources or studies that have been done that shown that people with insulin resistance this is people with insulin resistance right here, have increased the number of insulin receptors on the cell compared to somebody without insulin resistance. The prostate is not insulin resistant in this person. We have more insulin receptors on the cell so we can get more glucose in. And because we know that glucose is the primary fuel for cancer, having more insulin receptors just means there's a lot more locks there that you can actually insert a key into and get more glucose in. So we want to reverse or reduce that level of insulin resistance. So let's talk about a few other factors that play a role. And we know that a lot of people come here because they want to talk about their weight, but I want to talk about the different kinds of weight gain that are out there. This slide I like because they label it correctly. There's a fat fit and then there's a fat unfit. And there's two very big differences here. In this one right here, you can see that there's a lot of subcutaneous fat deposition, meaning this is the stuff that you can grab with your hands and jiggle. That stuff is not harmful. That is not going to lead to insulin resistance. The kind of fat that leads to insulin resistance is the stuff that's inside of our abdominal cavity, which is called visceral fat. And visceral fat is well known to be the main problem with insulin resistance, low testosterone, poor cardiometabolic health, all of the above. When we can look at things like visceral fat, and this is where I do recommend, if you haven't done it or if you're concerned, and I always say this with men, if you can stand up straight and look down and you cannot see your toes, you have too much visceral fat. If you have to bend over to see your toes, you have too much visceral fat. You want to make sure that you have reduced that waist circumference, which is so prevalent. But this study really did go in and just show that visceral fat measurements really are the best predictor of metabolic risk factors out there, above and beyond all of the other, what they call anthropometric, things that we can actually measure with a measuring tape or a scale. Visceral fat is the #1 predictor when it comes to metabolic health problems. This slide I really like too. They look at, as you can see up here in the top, at a variety of different markers that we're concerned with. What are your blood sugars? What are your triglycerides? What is your HDL? All of those things. And as you can see, there's a bit of a threshold. Right about here, when we get to about 10 centimeters or higher of visceral fat amount, and that's the number that we encourage at Insulin IQ, is to aim for below 10. Once you hit 10, you'll notice a couple of things start to rise. Initially, it's just these two, which are your triglycerides will go up and your HDL will go down. HDL is your healthy cholesterol. It's the one that we want to be high. So that combination, and we talk about it a lot here with the Feel Great system, that triglyceride to HDL ratio is a very important marker when it comes to overall metabolic health. So we see this problem right here happen a lot sooner than we see the rest of the problems, which are the high blood sugars, the other metabolic risk factors and whatnot that don't actually start to occur. Their threshold seems to be a little bit higher. So catching this at that 10 centimeters is really important in order to help prevent or reverse all the other things that can accumulate after the fact. I like this slide because I just think it really shows, again, all of these things are related. And that's the best thing and the worst thing about insulin resistance. If you have it, you're going to get most of these things. If you can reverse it, you're going to improve most of these things. And most of these, again, are related to men's health. So heart disease, loss of muscle tone, poor erectile function, things like that are the problem. But we can fix it with 1 or 2 simple interventions. And so I'm going to list them here and I'll go over them very, very briefly. What can you do? First of all, we want to get insulin down. Follow an insulin lowering diet. These tend to be low carbohydrate, high protein, moderate fat style of diets. Incorporate the Feel Great system. It is a wonderful, wonderful tool in order to help you do those things that will lower insulin. Incorporate some intermittent fasting, which the Feel Great system also helps with. Focus on some weight loss, particularly that visceral fat weight loss. Incorporate some resistance training. You can boost testosterone by increasing muscle mass. Do other things to boost testosterone, and I'll touch on those briefly. And those will help you to prevent problems with the prostate, improve overall health, reduce diabetes, coronary artery disease, and the like. Some other things you can do, and just because I do like to practice in an integrative way, maximize your thyroid, make sure that you're following a low carb diet. You know, maybe a gluten-free diet is indicated if there's autoimmunity.
If you're interested in that tea and fiber protocol that Lindsay's talking about, that's your link right there. So if you learn more about it, you go over here, you can click on that QR code, make sure you grab a screenshot. I've got the information up on my page. That other QR code up in their top, same thing. A lot of QR codes on here as Lindsay's talking, but this just gives you an idea about what you can do to learn more about this.
There, optimize your vitamin D. The more and more I see patients, the more important it is to make sure your vitamin D levels are optimized. Focus on things like sleep, exercise, stress management. Hormones, testosterone in particular, require cholesterol in order to be formed. If your doctor has you on a high dose statin, you might want to have another conversation with them about trying to not lower that cholesterol too much so you can continue to make testosterone, and then consider different supplements or testosterone replacement or the like. And I always like to share this. People say, oh, I just want to grow old, grace me, and not the people I love. I want them to fight it every battle, every step of the way. So do the things that you can to improve what we call health span, not just lifespan. We want to improve health span, improve all of these things, lower insulin levels, improve insulin resistance, consider some supplements or prescriptions, and make sure to find a well-versed provider when it comes to doing things in that realm, because there's a lot of nuance when it comes to boosting testosterone levels. And again, like Trent said, I always do a little plug for myself here at the end. You can find me at Venn Integrative Medicine or Insulin IQ. We do offer a 10-day free membership at Insulin IQ, so check it out if you're interested. So quick and easy, Trent.
Okay,